there, Autumn Bear here, acupuncturist and herbalist, here to answer some questions and talk about some interesting topics. Today's topic is going to be joint pain. We're not really talking about specifically arthritis in this circumstance. Arthritis has its own separate component. However, joint pain is things, achy knees, achy joints, stiffness, overall general joint pain that can come from some life and living, some of it can be injury related, so on and so forth. And overall, when we talk about joint pain, there's several things that are important when we're talking about trying to help our body rid itself of that particular pain. Pain usually means one of two things. Either there's some sort of stagnation that's causing some sharp, inability to move in that particular area, or there's some kind of deficiency that's causing that kind of achy, long-term pain that can really just be nagging and never seems to go away. So when we look at both of those circumstances, we want to look at a couple of things. First, we want to look at, how much hydration do you have in your body? A lot of joint pain, especially long-term joint pain, really comes from a lot of long-term dehydration. The hydration that we take into our body really is what is then created into the synovial fluids and the fluids that then nourish our joints and muscles. So when you start to get a lot of muscle pain, a lot of joint pain, you really want to start to look at your hydration. If you're not getting enough hydration and you're incredibly active, then it's important to increase that hydration, not just because we want to, have our 8 cups a day, which we're told is healthy, but really that 8 cups plus, if you're active, is going to be the main component in making sure that your joints have enough lubrication. The second thing is that if you have excess activity, or you tend to take in a lot of caffeinated drinks or a lot of stimulants of different kinds, so alcohol and caffeine tend to actually dehydrate you more than anything else. So if you drink a lot of coffee, or even if you just drink a little bit of coffee and you don't drink a lot of water to offset that, then you're going to over time really dehydrate the body, and that can lead to a lot of the things that we talked about before. Mobility is also really important when it comes to the movement of fluids in our joints. So it's not just exercise. I'm not talking about rigorous exercise. I'm talking about slow, nice, nourishing movement, whether it be some sort of rejuvenation in stretching, some sort of walking just to kind of get the blood flowing in the body, qigong, tai chi. Those are all movements that are slower and more calculated. They're less likely to cause any sorts of injuries. Overdoing it at the gym and running doesn't necessarily mean that you're doing your body a lot of benefit. There's a lot of things that can go wrong with heavy exercise and high impact exercise that can in fact damage those joints and cause those joints to be more painful. So when you're thinking about taking care of your joints, making sure that you are getting good hydration, making sure that your activity is not just high impact, but that you're getting some low impact stretching and movement to get those fluids going, and reducing the amounts of dehydrants that you have in your body, and hopefully that joint pain will start to decrease over time.